Hello, Mark, who is the chair, and Fiona, who's the vice chair of the IOSH Health and Social Care Group. And thank you for joining us to provide a valuable insight into the health and social care industry. This quick-fire interview is for those who are looking to start out their career in safety and health, or who are looking to make a change in career. Myself, Ellis Fenwick and Kezzy Randon, who are members of the IOSH Future Leaders Community Steering Group, and Lydia, our DOC, an IOSH student member, will now ask you a few questions to provide that insight. Lydia, over to you with the first question.
Okay, thank you for this great opportunity. So my first question is, what are the career path options in health sector?
So there's many an option for you, Lydia. You know, we've got many of the clinical pathways, which would either be in nursing or medical. You've also got the support workers around that. You've got porters, pharmacy, public health, as in the wider remit. You've got adult professionals, which covers physiotherapy, occupational therapists, podiatrists, art therapists, psychotherapists, radiographers, dietitians, music therapists, and many, many more. You've got administration, of which there are many types. Project management, strategic management. You've then got estates and facilities where, there's a range: catering, chef, cook, domestic, housekeeper, linen services. Capital, where they manage big projects. One which is involved with one of our hospitals at the moment, following Grenfell, is the removal and replacement of the cladding. So you can imagine that's a multi-million-pound project, so many professions involved in that. Laboratory, as in microbiology, communicable diseases, ambulance services, paramedics, emergency care assistants, procurement, logistics, information, digital intelligence, dental, environment, waste management, manual handling in occupational therapy or physio, human resources, and workforce and OD. And you've got the stuff then around occupational hygienists and all those. Ways into those, there are apprenticeships, there are graduate schemes, and depending where you work, secondment opportunities, or work opportunities to come into the NHS for you to actually taste what you'd like and which avenues you'd like to go in. Does that give you enough to think about?
Yeah.
And I can send you a list of these anyway, because it's a lot to take in. But, I think within the NHS, if you look at all the other sectors within the UK, there's not many that the NHS doesn't cover within its portfolio.
Okay.
So plenty of opportunities for young people like yourself.
Okay, thank you.
My question is, how does someone go about joining an organisation in the health sector?
Shall I take that, Mark?
Yes, please.
Basically, you go through NHS jobs. The usual routes of application the NHS don't tend to use. And as Mark said, you can go through apprenticeship. I myself had an apprentice who was coming through on the business section route, but got interested in health and safety. I also had a graduate who joined me, who was then going to do an MSc as an apprentice and have on in-house learning. So, it's the routes in are very broad and very varied. If somebody actually works in the health sector, I appointed somebody who had been a healthcare assistant as a student, but while she qualified to do health and safety. But because she had that healthcare experience and knowledge, I took her on as a health and safety officer. She didn't have the practical experience, but she had the understanding of how healthcare operated. So, they are, and sometimes if you actually work in the organisation, go and chat to somebody in the department. Face-to-face contact, or Zoom to face contact is always good.
Thank you.
Okay, so what does the health sector and organisations look out for in order to be hired as an OSH professional?
Okay, It depends what level you come in at, because, you know, as Fiona's just said, you know, sometimes you can come in. I've been working with people that have had plenty of experience within the laboratories, for example, but didn't have any health and safety qualification. So we'd say we take them through the NEBOSH certificate or equivalent with IOSH now. So say it depends what level you come in at. You know, even somebody like myself at assistant director level, I'm not actually required to be a member of IOSH because my knowledge, experience, and qualifications speak for itself at this level. But again, you know, I'd be very surprised if they didn't. You know, at entry level, you're looking at Tech IOSH probably, but you could be a student member, say, depending what grade you come in at, and then, you know, plenty of people that, you know, the group that I still chair of the southwest of England, which covers 40 odd trusts. You know, we've got plenty of Tech IOSH, Grad IOSH, and, you know, and the health and safety managers. You know, so it's you can have a lot within the ask of a job description, or within the write-up as part of that is working towards chartered or working towards grad member, because they do understand through CPD that takes a little bit of time on occasions. But as Fiona said, you know, it's about flexibility, a can-do attitude, you know, a willing to try and a willing to learn. You know, previous experience in healthcare is normally a good one. But again, you know, I joined back in 2004. I didn't have any NHS experience, but I had plenty of health and safety and management experience. You know, it is a complex organization, so they wouldn't expect you to know everything at once. You know, I've been in it now 18 years and I'm still learning on a daily basis. But, you know, if you take it back to if I was having to put a level on it, I would probably say the minimum of a Tech IOSH at starting. But again, if you didn't have Tech IOSH, if you were just going into it and you had plenty of knowledge and experience in other areas, you know, I would say, you know, to me, look at the job description and say, okay, I may not have that in healthcare, but I have it in this industry or in this sector. You know, don't let it put you off. Because having been somebody who's coming from outside of the NHS sector, they like that as well, because they like to get that balanced approach.
And if I could just add in here, I'm very similar to Mark. I hadn't healthcare experience, but I had knowledge of working in complex organizations. And I took on somebody who was grad IOSH because they had experience in an industry where they could transfer their skill set. And so whenever you look at a job description, look for where your skills are. What's your passion? That's something that I always offer. What's your passion? Because the breadth of activities in healthcare is broad and it's wide. And look at your skill set. What are you strong in? What do you enjoy doing? What do you enjoy learning? And what can you bring and transfer across to the health sector?
Fantastic, thank you.
Is there a social side to being part of the IOSH Health Social Care Group Committee?
Well, at the moment, we're all coming out of lockdown. So, I mean, I joined the Health and Social Care Committee nearly 2 years, well, it was 2 years ago, and we've had one face-to-face meeting. So it's something that we need to regroup and we need to work on. You know, with Zoom, with Teams, there is something that you can actually join in. And previously, we did have sector-specific topics. The last conference that was run was on manual handling. So, you know, sometimes it's about getting the additional learning as well as the social side, because quite often a conference, one of the bonuses is about networking. My own networking experience, I am known as having the restaurant as my second office, because I like to sit down with a cup of tea with people. So I bring that onto Zoom now. But it is important to, in your own groups, to network, and whether that's through email, so that you've got a cohort of people that you can ask. Quite often in healthcare, you might be the sole person, or, you know, maybe there's only 2 people in the department, so you won't have the knowledge and skill set of other areas. So through IOSH, you know, you've got your student network, you've got your future leaders network, and you've got the specialisms network with health and social care. And we are available through LinkedIn and through emails. And so if you needed to have a specific question answered, that is one of the routes that we can go through as well.
Okay, thank you so much.
My question is, where do you see OSH in the health and social care sector heading next?
I think, you know, for me, I think the the challenges of COVID has brought to the forefront the digital network and the digital opportunities. More organisations and sectors than others, but even within healthcare, we've seen some vast strides forward in the use of technology compared to what we would have had we not had the pandemic. So that's got to be a positive out there. So building on that, I see us working more widely with the other groups and sectors within IOSH, because as I've already mentioned, and Fiona, you know, there's not many areas that healthcare doesn't already fit within, you know, because we could fit within construction, we can fit within finance, we can fit within the public sector, you know, communications. So I see that network providing a platform to move forward and do a lot more collaboration going forward. I also think that we'll be using a lot more of artificial intelligence, you know, so, you know, I don't know whether you know about BIM, which is a construction software where you can actually walk through a building with your goggles on. So, you know, I see us doing things like that in theatre procedures, so we can see, okay, where is the learning in that? The same as if we've had, you know, a fatality incident or a serious injury incident, we could actually map that out, do it artificially and say, okay, based on the information that we have, how do we build that artificial intelligence so that we can learn from that, you know, and then pass on that learning to get safer systems in place? Because the more that we can design things out, the safer it is for everybody. So, you know, for somebody who's quite keen on IT stuff and also frightened of it at the same time, I see it as being a big benefactor going forward. And I think with young people like yourselves coming into the sector, is only a good thing for us.
Thank you. That sounds really exciting.
I'd also like to add about human factors and ergonomics, because, you know, it is an industry where, especially in incident investigation, it is something that you need to consider. When you've got a high cognitive loading, which you would have in, say, A&E or intensive care, looking at those human factors, looking at aspects. And I've used the skill set myself when I was investigating incidents, and it does give a broader approach from just asking why.
So what safety areas or issues was an OSH professional look to see or gain experience of in your industry?
Okay. Well, I think, you know, if we go back to question one and you see the wide variety of areas that we cover, you know, there's vast amount of knowledge and experience that you can gain from being within the health sector. You know, I think of my time, you know, in healthcare, I've covered so many different things. I would not have gained that knowledge and experience had I been in a typical sector or industry. You know, because I'm lucky enough to cover construction stuff. I cover ventilation, gas works, you know, your typical health and safety stuff. One of the things I'm doing, which I never thought I'd be doing when I started in the health sector, I'm actually leading on the learning from patient deaths through COVID, you know, and looking at that from a clinical side as well as a health and safety side is quite fascinating. You know, and the learning we're going to pick up from this will help in other areas. So, you know, that's just giving you one example of some knowledge and experience I've gained that I never thought I would. And I think within the healthcare sector, you know, no day is the same. You know, I know you often hear that phrase, but I can come in, I can have my diary all set out, and that will go as soon as I come in because other things have happened, you know. So if you are looking to get into to health, which I hope you are, you know, particularly within health and safety, I don't think you look back and, you know, typical things like manual handling, which you get in every industry, but, you know, the complexities of the patients, you know, where a moving handling specialist had a particular bariatric patient in theatres. We had to have 4 specialist health and safety advisors in there from moving and handling, plus the anaesthetists, plus the surgeons, plus the theatre team, and getting them into the right position so that they wouldn't put them in any harm, and aid them through that process of that operation to be successful. You know, you can't gain experience like that in any other industry. So, you know, I would just say to you, you know, whatever area you're looking to go into, have a good look at the healthcare sector, because I'd be surprised if we don't cover it.
Thank you.
And for me, I'm a systems person. You know, I started in lab work, quality control. I like a good system. Health and safety is all about systems. So I took my skill set and I came through food safety and health and safety. So, you know, there's the catering elements, there's the food safety, there's microbiology, there's pathology. So that's my background. Whereas if you are more construction focused, then there's more for estates. You know, if we have environmentalists, you know, sometimes we have a joint degree with health and safety and environment. There's a wealth of knowledge and experience is needed in waste management, you know, control of waste. That's a huge thing. And we're looking at sustainability, net zero going forward to 2040. Yeah, healthcare is a growth industry, and yes, you will learn an awful lot from whichever department that you would, you know, care to join.
So I just had to finish off on that. You know, everybody thinks of healthcare, they think of doctors and nurses. Healthcare is very much more than that.
Well said. Thanks, Mark.
Thank you both. That was really useful information. And we're sure it will help inspire lots of new OSH professionals.
Yeah. Thank you so much,
Okay,
Fiona and Mark.
thank you.
Yeah, I
Thank you
enjoyed
for
the
inviting
session.
us. Yeah.
And just to say, we are both contactable. If you've got any questions after this, you know, or through your career, please feel free to contact us, because it's nice to pass on our knowledge and experience for those who are following after us. Because if we can just inspire one person to come after us, then we've done our job. Hopefully we'll inspire a lot more than one person, but you know, it's you are the guys of the future.
Yeah.
You know, I'm still here at the moment, but I'll be retiring in a few years' time, and hopefully you'll be around then to manage my safety going forward.
Thank you.